multiple episodes of trance-like states. Do we have any evidence that when Danny comes out of his trance, he either has or does not have memory of the gap of time that he was in that trance? No memory? Okay. What else did you observe?
He has a friend, Tony, that lives in his mouth.
And Tony's a little boy. Does not sound like a little boy.
A little precocious Tony, eh? All right, so we have an imaginary friend. The good news here is that we actually not only have an imaginary friend, disclosure of Tony to a pediatrician, and then the evaluation and medical opinion that it is completely normal, right? Reassurance, right? So we have more than just the observation of an imaginary friend. Talk to me a little bit about imaginary friends in terms of how they evolve. This is as good as it gets, by the way, for child adolescent psychiatrists from...
They should be gone by the age of 6.
6-ish, right? Right. So, developmentally appropriate, certainly up to the age of 6, right? So give me a little bit more of that culturally sanctioned behavior. Why might a child who is younger than 6 develop an imaginary friend?
Probably like the feeling of like isolation and everything.
Right, there's some conflict, right? So why create an imaginary friend, and why not resolve the conflict like you and I might resolve it?
They haven't developed that yet.
Yeah.
They haven't developed it yet. Like
Develop what?
the ego?
Well, I would actually suggest that the observation of an imaginary friend is representative of a developing ego. How can I say that? Other than the fact that I'm wearing a short white coat and you're not. I'm sorry, a long white coat. Like I'm still back in medical school days. Nobody corrected me. Nobody caught that. Thanks, guys.
I was thinking it, but I didn't want to like.
Thank you.
You are the one with the white coat, so.
Right. Long white coat. Danny has a conflict. There's something in his id that is striving for conscious expression that his superego will literally not allow him to think about. Right? So there's a protective mechanism that prevents that impulse from coming to conscious awareness. How we struggle with this, Danny or other, is through ego strength. And the way the ego mediates this is through these unconscious processes called defense mechanisms, one of which is fantasy. The imaginary friend is but one example of fantasy, the defense mechanism, the process of the ego that mediates and hopefully resolves the anxiety caused by the friction between that pleasure principle and what the id wants to express, but the superego will not allow expression for. That's exactly what's going on here. I don't know why Danny resorts to fantasy versus denial versus projection versus other. Who knows? When an individual, and it's not a conscious decision, but when an individual employs a defense mechanism, that will either be beneficial or not, and that benefit versus not then moves from the psychodynamic theory to behavioral theory in terms of what is positively versus negatively reinforced, positively versus negatively punished, right? So you could definitely merge the two theories together with regard to the crystallization of a defense. In this case, fantasy. A specific example would be the imaginary friend. Give me another example, by the way.
Defense mechanism?
No, of an expression of fantasy.
Expression of fantasy.
His hallucinations? Like what he thinks he's seeing?
It might be. There's even something more culturally sanctioned that's in this movie. No? Outside of this film, what is another common, again, part of fantasy play for a child, which I would say over half of homes in the U.S. probably have for the children. Maybe 30% to 50%. Teddy bear. Right? Teddy bear. Now, teddy bear not only is fantasy, but there's probably another complicating defense mechanism called, it's not animation. I'll get it. It's on the tip of my tongue. But the interesting, I think, thing here for Stanley Kubrick is that he not only provides us evidence of fantasy as a defense, but also the fact that Danny has a teddy bear. And another example of fantasy play, imparting real-life qualities, animism, real-life qualities to an inanimate object such as a teddy bear. And that's telling because the teddy bear is actually linked to the very reason why Danny created Tony. We'll get to that later, maybe even offline. All right. Other observations about Danny Torrance? Other questions, by the way? Any questions about fantasy play? By the way, having a tea party, fantasy play too. I'm surprised you guys didn't think of that either, right?
After the age of 6, though, right?
Well, again, developmentally appropriate, 6 or younger. And I don't think there's any real hard and fast rule. I mean, there's no way the child blows out their candles on the 6th birthday and all of a sudden they're not going to invite you to the next tea party, right? If you are, you did something wrong where you're off the invite list. Right? But sure, as you get older and as you get beyond 6 years of age, it warrants some attention. But
What is the difference between having like an imaginary friend as a defense mechanism and DID?
yeah.
Like how do those differ and what are the similarities?
So DID is a formal diagnosis that is defined through a distinct personality state that takes over one's conscious awareness, their station. So that has nothing to do with an ego defense that alleviates anxiety. Right? All ego defenses have a primary goal, and that is to alleviate anxiety caused by that friction between the id and the superego. Fantasy being one example. For DID, we're not talking about an ego defense mechanism. We're talking about an established mental disorder. And that mental disorder is defined largely through a distinct personality state that takes over one's conscious awareness. And that is not fantasy, which is why I think despite the pediatrician's best efforts, she is way off base here. Sure, having an imaginary friend is fantasy play and perhaps age appropriate, but she never investigates this any further, otherwise she would have realized that somehow that quote-unquote imaginary friend is linked to Danny losing consciousness, right? And that, I mean that both having an altered conscious or an altered state of consciousness for which he has no memory, and he actually demonstrates that to her. The last thing I remember is...
He says he doesn't remember
No.
anything. Yeah.
Yeah. She asked the wrong questions, unfortunately, right? And even though Danny's presentation looks to be that of an imaginary friend, closer inspection reveals that it is much more than that. It is a distinct dissociative state for which he is amnestic. And that gets us into an entirely different conversation.
Because he gets very anxious. Like you can see, they show him getting very anxious and very distraught, and then before, like he starts like that towards the middle end, right when he's speaking for Tony, and Tony's the one that's predominantly there. Like you could see that he was in that anxious state and not feeling well when there was all that going on, and then he starts speaking for Tony.
Yeah. No doubt, and the other part of this too that I think is even more superficial and therefore something that this pediatrician should have definitely focused in on but blatantly missed, is that he lost consciousness. And imaginary friends, no imaginary friends, a child should not lose consciousness. There's no reassurance there. There's a transfer to the hospital, there's admission, and then there's at least a neurological, if not cardiology workup. You have to evaluate that, not reassure and have them go live 6 months in a snowbound hotel.
Yeah.
But mistakes are made everywhere, unfortunately, along the way in this movie.
Yeah.
Do you think if he was older it would be like schizophrenic symptoms, or does that have to be like adult almost? Could like kids have it?
It is very, very rare to have childhood onset schizophrenia. Extremely rare. So I would not consider that in this case.
Okay.
And again, having auditory hallucinations, having delusional beliefs is just significantly different, qualitatively different than having a distinct personality state or dissociative state for which you're amnestic. They're two different things. Although neurobiologically there's significant overlap, we approach them as two very distinct entities right now in the DSM-5.
What do you think of the visual that Danny kept seeing of like the blood rushing through the hotel hallway? Like, what if he did end up remembering that? Like, what would you classify that as?
I still go with the dissociative state. However, if we're going to kind of just throw a little bit of a curveball and say, no, he's fully cognizant and he remembers, it seems as if his left brain was still active and still functioning, and therefore those memories were recorded. Flashback. Right? It's flashback. Something happened.
Isn't that a little scary for a child to even, like it has to come out of his brain, but a child is seeing that? Isn't that, like, for his age?
Oh, yeah.
Is that not weird?
First of all, it's frightening to actually watch it as someone who
Yeah.
hasn't experienced it themselves and watching this movie. Number two, if you were a character in this movie as an adult and saw that, it's even more frightening. And now, now bring it back 2 decades, 3 decades younger, and yeah.
What do you think led a child like that? Because I don't see anything like past for him that would have traumatized him, that made him see something. Like, how does he? You can't imagine something like that unless you see it, right? At that age. So
that is a little bit more of a difficult question to address, because if we go with Jung theory or Jungian theory, he primarily departs from Sigmund Freud in the idea and the concept of the collective unconscious. So he didn't dismiss the personal unconscious, but that's where Freud's theory stopped, right? So we all have experiences for which we've incorporated memories, registered memories, and therefore retained memories, some not retained. But that all makes up our personal unconscious. Carl Jung agreed, but added to that theory with the concept of the collective unconscious, which is what? Not likely to come up on a shelf exam. Although it is fair game, just in case. The Jungian collective unconscious.
Like past life?
Yeah, right. Specifically, the experiences of your ancestors. So there's ancestral memories that are inherited. Right. So while it is true that at this age, it is unlikely for Danny to have experienced anything like that. Number one, I'm not so sure that's true, in much as this might be symbolism and what that might symbolize, and maybe there is something in Danny's personal past and therefore personal unconscious. But even in addition to that, maybe this is an expression of Danny's collective unconscious, and whatever that means. So that's something more for a psychotherapist, especially one that is dynamically oriented. Probably not something we're going to address in office as a psychiatrist. Other observations, Danny Torrance.
We could talk about the room 237 when it was open and then he came back out and he was bruised and all ripped up and everything like that. So both Jack and Danny saw the woman in the tub, right, from what we noticed. But then also Wendy accuses Jack of harming him again. And so it's like, okay, did they both actually see the woman, or did Jack lead Danny into that room?
Yep. Let's start with Danny and have our primary focus on Danny first. And Jack certainly offers his opinion on this. What is your opinion? What are the potential options here in terms of this child's self-report? First to his mother, then of course from Wendy to Jack. So we have the information. What is our initial impression? What do we make of that information? What are some possibilities here?
I mean, I really think that Jack had led him into the room and then had told him what to say, because, I mean, getting into Jack, like, he was having hallucinations of like Grady and like talking to him and like about it, like as if it was like validating him and his own like homicidal urges. So I feel like he just told Danny that's what was happening, or like that's what you should say, because he didn't outright come with it until like, I don't know, like 5-10 minutes later when Wendy was alone with him.
Okay, so that's definitely a valid option, and that's the exact thing that Wendy has concluded, that you've hurt our son again. Other potential options here?
Oh, we didn't also talk about Jack hurting Danny, dislocating his arm, and then turning to be 5 months sober.
Yeah. There may or may not be alcohol available at this hotel. I honestly don't know. But even if this hotel were in fact dry, his past history of abuse, physical abuse, certainly poses risk. And again, there's only 3 people in this hotel. I think Wendy's assessment is the one the reasonable person would initially draw, that Jack hurt his son again. What are some other options?
Could you possibly say this is like the folie à deux type thing, where it's like you have the delusion where you transfer it to someone else?
Quite possibly, yeah. But that even if that were true, it still doesn't resolve our question, and that is, who hurt Danny Torrance? Right. So I mean,
Did he
option
hurt
one.
himself?
So that's one. That's another one. So, and that's the one Jack proposes. I think he did it to us. And interestingly, when he tells Wendy that, he makes a comment. He's done this before. I would love to know more about that.
And also the story that like Wendy kind of like disregarded it to the doctor. Not disregarded it, but like, she was just like, oh, it's like the kind of thing that just happens.
Yeah. Other options.
I also think it's interesting that like Jack very casually said that like, oh, he must have done it to himself, and then she had forgotten about the idea that maybe Jack had still hurt him in that moment. Then she kind of like let her guard down, and that's kind of when you can like see him being very manipulative. And I think that builds a stronger case that it was Jack who had done it. Especially when towards the end when Wendy locks him in the food storage fridge, and you can see him changing through different emotions, and to see like what will get him out of there, like appeasing to Wendy. It's like he's very good at being manipulative, and she clearly has not really seen that side of him yet.
Yeah. A counterpoint, though. In your observation of Wendy's change in affect when Jack brings it up, I wonder if she's been repressing that past experience where Danny harmed himself. Right? Because as soon as Jack says it, I wonder if we would read her change in affect as something coming to conscious awareness that she had repressed and now is overcome because Jack forced her to actually think of it. So I'm not sure what's going on here. But what other options do we have? If it isn't Danny doing it to himself and it isn't Jack, there's
mother?
So that's another option. There's only 3 people here. So that's something to consider too. Right? And to the extent that we might be convinced by looking at her affect, by observing her affect, and certainly hearing her report, that it cannot possibly be her. And I do admit she's a 3rd place on our list of 3. Remember, there are a lot of things that has happened that she doesn't recall. And that all comes out at the end of this movie, where she sees all those ghosts as well. So it takes a lot for her to overcome whatever barriers or whatever she has in place to protect her from those memories, but they flood in the end. So might this be another incident where she's repressing something, and maybe it's that she, of all people, has harmed Danny and has done it again. So that's another option to consider here. There's one more option, and I don't want anybody raising their hands, and you guys are off video, so you feel free to. Actually, you could raise your hand, but I don't want anybody to say anything. It is audio only. Anybody here in a steady relationship, 1 year or more? Right, so you're in a steady relationship. You know who you're going out with. You know who your significant other is. Very similar to this couple, right? In a situation like this, when they tell you, I didn't do it, and you know you didn't do it, if you're thinking about this, you have, I think, now two options to consider. One, of course, is that my son did it to himself, but as a parent, it's going to be difficult to accept. There is another, a fourth scenario here that I think any parent would have pop in their mind. And no, it's not a ghost.
That someone else did it to them?
So what does that mean?
Maybe like they left like their child unattended with somebody and like.
But you're in a hotel.
Oh, that's true.
Like the chef, being.
He's out. He's been gone.
That there's somebody else.
Yeah.
Yeah.
I mean, I probably would check every door before Ullman and company left to make sure everything's locked down. You're in an enormous hotel, literally miles away. I'm talking distance as well as elevation from anyone. The idea that somebody may have gotten into that hotel is a little frightening. We're not alone.
Yeah.
So that's something to consider. Now, again, I don't think it's a ghost. I think it's probably somebody who probably thought to escape the inclement weather, survive, but then something happened. So I'm in every room, checking every door, and it better be locked from the inside, right? And that includes every window too, before I say, oh, maybe it is Danny, right? So that is a fourth option here, and I think that's one that probably would pop up. We're not alone. Right? I mean, they cannot be comfortable in this. Well, they're not going to be comfortable in this hotel for a lot of reasons, but realistically, that might be one of them. Right? All right. Any final thoughts? Any observations left? Danny Torrance. We're good. All right. What other character you want to discuss today? Jack. What did you see?
Literally everything about him.
What do you got?
He's arrogant.
Some arrogance?
I mean, like, yeah, very disrespectful, but I also like kind of noticed like this grandiosity to him in a way that he like took the biggest room in the hotel, right, like the main area to himself, and said that when he could not even like walk around him. Like that's really ridiculous, and I feel like he like took the hotel as if it was like supposed to be his, like, oh, like it's my big place now, which is like, I don't know, I feel like that says something about him, that he like thinks of himself so highly, or that he thinks he's deserving of it. And then a lot of the things he talks about as if Danny and Wendy are interfering with his life and his success and his potential, and he takes that out on them.
He does.
Bless you.
Thank you.
Like an alcohol-induced something he has, for sure.
Well, he is scripted as having alcohol use disorder.
Yeah.
So that's certainly a start, and even Stephen King, who has disowned this movie, will admit that this character was created to include the diagnosis of AUD. So that's established. I actually want to take a little bit of a specific and perhaps different direction with this in terms of everything that you just observed and stated. For a psychotherapist that sees this, call it arrogance, whatever you might call it, I want to know more. And if you know this story, there's a lot more that supports your observation. So the hint is that this is not likely to be something that the physician would address in a med check, but certainly very important aspects to his history that would definitely be something brought up in psychotherapy. So, what do you know about Jack Torrance, the character? It's one thing to say he's arrogant and maybe he reaches or doesn't reach the formal diagnosis and threshold of narcissistic personality disorder. Fine, all right? But there's much more to it here. When he interviews with Ullman, Ullman gives him full disclosure. There are comments made by this person that I think one would draw the conclusion that he might not be the quintessential husband or father. What happens in that interview? What content is discussed? What information is exchanged that would give the clinician a pause? I mean, Ullman tells him that there are people that have taken this job that find it very difficult because of the isolation. And even tells them that it's driven some people to do things. And he discloses what happened. He calls it amok. That's spelled A-M-O-K. That can, in fact, be on the shelf exam. Amok. What is amok? Amok is a culturally bound syndrome. What is a culturally bound syndrome by definition, and how does it compare and contrast to a culturally sanctioned behavior?
Does that have to do something with like parasite, like infection or something like that? Does it have to like something that has to do with like parasites or something like that? Or is that a different thing?
It's a different thing.
Okay.
That thing.
I think like culturally bound syndrome is some sort of disorder or disturbance that you only see in certain cultures and not in others.
Definitely true, and that is the core aspect, and a core aspect that is shared with a culturally sanctioned behavior too. So that's how these two will present, looking exactly alike. Now give me the differentiating factor that allows you to say it's A versus B.
Whether it's considered like aberrant or abnormal.
That's it, right? So a culturally bound syndrome is syndromal. It's considered abnormal even to that geographically isolated culture or area. Right? That is not the case for culturally sanctioned behaviors or beliefs. There the focus is on the word sanctioned. Within that geographical locale, the behavior, the thought, is considered to be completely normal. It's normative. All right, so that'll come up in exams. All right. So amok is a culturally bound syndrome. What is amok? So it's a behavior that is isolated to the Asian continent, where individuals with no prior history of violence will all of a sudden and transiently become very violent. And sometimes it actually ends up in their suiciding, actually killing themselves. Right? The U.S. terminology, which is actually in textbooks, but I don't think is universally used in clinical practice, is quote unquote going postal. Charles Grady did not, and Ullman says, mild-mannered, family guy, no prior history. So he actually, and then he uses the word amok. That is the exact definition. With no prior history of violence, a big deal is a core part of the definition of this specific culturally bound syndrome called amok. So again, it's in a brief scene, but it's something that I've seen on exams before. All right. So what is Jack's response to all of this?
He said something about like, oh yeah, I've been looking for the isolation, I need it. It was it's kind of came off a little bit odd, because like that's like 5 months of solitude. But the way he said it, he seemed like just excited for it, like a little gleeful about it.
Yeah.
It's like perfect for writing. It's like almost like enthusiastic about it. So.
Yeah. You know, even though it's intuitive, it's nice to kind of play shrink and really break this down, because when he uses the pronoun I and when he talks about how it's exactly what I need, it's perfect for writing. There is little to no chance that Wendy and Danny are both authors as well.
Yeah.
Right. So this comment and this experience for this character is totally devoid, completely unempathetic to his wife and his child. Right. So, but there's even more to it. Why is he needing to write a novel?
He said he was a teacher, and before that he was a writer. I don't remember.
Yeah. So the backstory is that Jack Torrance was a teacher at a prestigious prep school in Vermont. And it's unclear whether it was under the influence. It suggested that it is, that he struck a student. He physically assaulted a student, got fired. He ends up in Boulder, Colorado, and he's out there without a job. So he's got to write, right? So now you have a situation in which he's telling this to Ullman. He's giving you kind of just the peak, the top of the iceberg, the tip of the iceberg. But the whole reason why he's there, the whole reason why he's in Colorado is because of him and his failure to be the primary provider. So when we see this individual as someone who is very self-absorbed and neglectful, both emotionally and otherwise, to his wife and his child, that's where it's coming from. It's a sense of failure. Again, a lot of stuff there for the psychotherapist. The bottom line here, though, for the clinician, for the physician, psychiatrist, is that he might actually present the clinical practice, and you might draw the conclusion that, wow, this is a depressed individual. Given all of that, the likelihood of any antidepressant having a real effect is slim. Right? The miss here, and not refer him to psychotherapy, would be detrimental to his outcome. Nonetheless, he's not going to get medication. He's not going to get any therapy because he's stuck for the next 5 or 6 months at a snowbound hotel. And so, what else do we know about Jack Torrance?
He seems to not like doctors. He seems to get annoyed by the fact that Wendy keeps bringing in doctors for Danny. I don't know why he finds that bothersome, but he doesn't seem to like that. That's interfering.
What about that?
He's scared that the doctor will figure something out about him.
Yeah, I think there's two things here. One is, I think, very direct, and that is, the less people, the better in terms of what they may observe and therefore intervene. But I think there's also some displacement too. He's had some run-ins with folks, and he's had some run-in with some folks who are MDs or DOs. So it may not be the pediatrician or the particular physician who is evaluating or caring for Danny, but he's certainly projecting or displacing his feelings onto them, given his past history, likely with psychiatry.
And compared to Brady, he does have actually a past history of aggression or violence compared to him. So it didn't come out of nowhere.
Yeah, and we'll start off broad. That does allow us to discuss the biopsychosocial formulation of Jack Torrance's behavior. And within the biopsychosocial context, there's what we call the two-hit hypothesis, right? So how the initial hit, which is usually biological, is paired with a second hit, which is largely psychosocial, often called the precipitant or trigger, resulting in the expression of behavior, including the expression of abnormal behavior. So given his past history of violence, that is a psychological predisposer, right? Anger management, affective control, psychological predisposing factor. Of course, the social isolation, the social factor would be that second hit, which is the isolation that is afforded through moving into the Overlook Hotel. So we could look at it biopsychosocially as well as the two-hit hypothesis because they're synonymous. Now, two-hit is seen within the context of biopsychosocial. One hit, second hit have, again, specific factors contributing to each. That two-hit hypothesis is something that we usually use to formulate the initial psychotic break for schizophrenia. Right, so we look at what predisposes, that's the initial hit, usually genetics. And then we look at that second hit, what precipitates. And that's usually psychosocial. And on shelf exams, that's usually somebody between 18 and probably 25 because of the increased stress with school, including graduates. Usually a graduate student that ends up having a first break psychotic episode. So Jack is a little late for that. But that also assumes that his past history, the prequel, he's not being treated or otherwise previously diagnosed. We don't know. Other ideas, Jack Torrance.
I mean, I think all of it tied together is he's might have narcissist personality disorder, but a lot of it kind of is just to protect his own ego with his past failure as a teacher, hitting the student, and now also maybe trying to overly protect his kids from doctors. It's all just a reflection of his own ego.
No doubt about it. Yeah, I mean, there's a lot here, and even the way in which he talks to Lloyd about Wendy and how she'll never let him forget it. I'm going to leave out the explicatives. Wendy's become the externalized, maybe maternal, perhaps paternal voice that he has in his head. Right? She is the amalgam of all those things. Probably his parents said to him how much of a failure he is and how disappointing he is. And you kind of see that come out when he talks to Lloyd. Which is interesting because, again, the dynamic there not only is usually patron and bartender, which a lot of stuff comes out, but of course the influence of alcohol can't be dismissed either.
Yeah. He also says to Lloyd in that in the gold room with him that first time was like when he was talking about Wendy. He's like, Lloyd said, women, you can't live with them or live without them, and he was like, wise fucking words, man. Like, and I don't know, there was just like that, and then when they had referred to Dick, the head chef, as, the N-word, right? I feel like there's a lot of racial and misogynistic sort of biases at play with him that only really came out in those times, like when he's with himself, talking to himself.
Yeah.
Yeah.
Thank you.
And I think that's largely by design too. I mean, Kubrick, I don't think makes any apologies for a lot of Jack's certainly, but even the Overlook's quote unquote behavior, alluding to Native American genocide. Right. So if anybody's watched the documentary Room 237, there's several segments where people, historians, literary critics, anthropologists, etc., discuss what The Shining is really about, and Native American genocide is a big topic in that movie. Ullman tells Jack that this place is considered to be cursed by some because it's actually built on sacred ground, right? Native American burial ground. So there's that supernatural aspect, but Kubrick brings this out with more, at least at the time, 1980s current prejudice as well. Other thoughts, Jack? So I do want to relate this back for shelf purposes to Jack's first break psychotic episode. I think a lot of the things that we experience or we see through Jack's eyes is consistent with different psychotic signs and symptoms. He probably does demonstrate fixed beliefs and therefore is delusional. He hears things, he sees things, he has perceptual disturbances. He already has two of the necessary threshold of 5 symptoms of schizophrenia, both delusional as well as perceptual disturbances. This is definitely disorganized behavior. All work, no play makes Jack a dull boy. Disorganized behavior. Disorganized behavior also includes aspects of catatonia, which appear in this movie as well. He has episodes in which he is unresponsive. And even if we stopped there, even if we thought conservatively we're not going to diagnose or identify negative symptoms, nor are we going to say that we feel there's disorganized speech, he still has 3 out of a necessary 2. So he meets the diagnosis of schizophrenia in terms of the first pass. The second pass is to appreciate that this condition, schizophrenia, is a diagnosis of exclusion. And we have to consider as clinicians that Jack might actually be manifesting these signs and symptoms due to another condition. And the American Psychiatric Association requires us to investigate 5. So what are the 5 mental disorders that we have to investigate and rule out in order to continue to rule in and work up schizophrenia?
The phreniform schizophrenia.
So a brief psychotic disorder and schizophreniform disorder we do not have to rule out. That'll be teased out with regard to time frames and duration later.
Like mood or like bipolar with psychotic.
Right, so
depression with psychotic.
Definitely. So primary mood disorder, up to 20% of individuals with major depression will have evidence of psychosis at some point in their lifetime. That number increases to 50% for bipolar patients. So we're definitely going to have to investigate a primary mood disorder.
Schizoid and schizotype 1?
So fortunately, we don't have to rule them out. They could certainly coexist and sometimes even are a pre-existing condition that increases risk for developing schizophrenia later in life, including when you're 18 to 25.
Substance use?
Yeah, substance use and therefore a substance-induced psychotic disorder. We know he has alcohol use disorder, so that's primary concern. And that includes what alcohol may induce, like Wernicke's encephalopathy due to severe thiamine deficiency. So we can't rule that out without a blood test, and he's not going to get a blood test anytime soon. So we're going to have to keep that in our differential. 3 more.
The medical.
Yeah. He's an older male, which means that he might be medically complicated, and who knows the last time we saw a primary care physician. So we're going to have to leave medical condition manifesting through psychotic behavior in a differential too. Two more.
Some sort of delirium or delusional.
That would be part of general medical condition.
Schizoaffective?
Yeah, schizoaffective disorder. If we're going to leave a primary mood disorder in, the combination of symptoms, that is co-occurring mood and psychotic symptoms, hallmarks schizoaffective. So we're going to have to leave that in too.
Is autism one of them?
And autism spectrum is the last one, yeah. Now, fortunately, we could rule that out, even though we have no pre-existing history in terms of any kind of valid history provided to us by the patient, or in this case, his family. New onset hallucinations and or new onset delusions allows us to diagnose schizophrenia even with the pre-existing condition of an ASD. So whether or not he has true ASD prequel is largely irrelevant here in discussing schizophrenia as a new disorder or new onset disorder, right? The reason why this condition, ASD, is something that the American Psychiatric Association requires us to investigate is because of overlap in symptoms. Largely deficits of communication and behavior, not delusions, not hallucinations. So the fact that he has both does allow us to diagnose schizophrenia, or at least continue that workup, even if he had a pre-existing history significant for ASD. Anything else for Jack Torrance?
Well, we have the image at the end of the movie where it seems as though his face is in an image from the 20s.
Yeah, I think there's 3 scenes in this movie that people have a difficult time with, if not fun. Very few people watch this movie for the first time, have those closing credits come up, and don't begin to obsess over the meaning of that portrait. Like, what did I just say? I just endured 2 hours of this movie. I was on a roller coaster. I feel like I've been put through the ringer, and now they give me this. What's going on? What is that portrait all about? That's one of them. What are the other 2 scenes that really disturb people that you just can't see? You just want to get on Reddit and blog it. Even in 1980, when this movie premiered. It was a joke. Yeah, no. Okay.
Bearman scene?
Yeah. If you're comfortable with that Bearman scene, there's something wrong with you. That's a very disturbing scene, right? It's also very disturbing because it's Wendy that actually is having a psychotic break at that time, right? So again, if you choose to watch this movie through a supernatural lens, you're horrified because now she is seeing ghosts. But if you're choosing to view this through a psychiatrist lens, you're just as horrified because now she just had a psychotic break too. And the way she has it, again, Kubrickian, is very disturbing. And the other one is the River of Blood scene that we already brought up. So you brought it up without me prompting you. But that's a third scene that people struggle with, largely because there's something in the blood if you stop the frame. Right? And that's all over YouTube. And nobody knows what the heck it is. So there's a lot of speculation about what it is and what it means. So those are the 3 scenes.
What is it? What is in the... like a person?
No, it's not a person. No, there's something in the... No. Again, don't look it up without having at least half your Saturday dedicated to going down that rabbit hole. So we're not going to take all 3. We'll be here all day. But instead, any observations, any opinion on what the portrait means?
I think it's his grandfather. Because if it's like a youth, then 19, 24, 21, it would possibly be his grandfather.
Interesting. Okay. So keeping consistent with our discussion, this maybe then defaults to a discussion of the heritability of conditions like schizophrenia, right? Twin studies and genetic predisposition and heritability, right? I told you.
I'm on Reddit.
Other thoughts about the portrait? Are you for the portrait or the elevator?
No, the elevator. The portrait comes later.
It can't be his grandfather. How would he end up in the same place then as the grandfather in the same...
Well, if you watch Dr. Sleep, Danny ends up in the same place too. Spoilers.
Yeah.
By the way, don't watch Dr. Sleep.
What if it's a ghost?
That's always an option, but unfortunately not one a psychiatrist would consider.
It's like him inserting himself into like a place where he thinks that he belongs, but he doesn't.
That's possible, but again, spoiler. Again, hopefully everybody here knows what we're talking about because you've watched the film. He's already dead by this point, but so it's hard to convince ourselves that we're seeing through his first person perspective when his first person perspective would be somewhere in a maze, frozen.
Danny, did he do it?
Did he do what? I mean, did he make himself up look like his father and get
put it
into a
out?
time machine and go back to 1921? I don't think so.
Jack did mention that he said that this hotel felt like home to him. Like when he was like, oh, this place before we came here seems so scary. He's like, oh no, when I just got here, it felt like I'd been here before.
Yeah.
So that I just remember that.
Maybe he repressed it, and he like grew up there in his childhood or something. He just like blocked it out because clearly.
So he grew up there in his childhood, but never aged. So we got like a recreation of Peter Pan. By the way, this movie does allude to Peter Pan, right? When Danny sits on his lap and asks if he likes it, Jack's response is that he wishes he could stay here forever and ever, right? So there is a Peter Pan allusion here. So when Ullman provides him the history of the Overlook Hotel, he tells Jack that a caretaker ran amok. Who does he say ran amok?
Edward Grady. No, Grady was the last name.
Yeah.
Is it Charles?
Yeah, Charles Grady. Later on, Jack meets a former caretaker.
Yeah.
Who does he meet?
Delbert.
What about that?
Has he ever mentioned before?
No. So Kubrick plans this. That's not a mistake. There are two Gradys, and there are two Jacks. Yeah. And again, I'm going to refer you to YouTube for this. There's a wonderful commentary on this, on where the second Jack is during this movie. You have to look for him to see him, but you see him.
In the blood.
He's not in the blood. That would be cool, but no, it doesn't get that cool. When an individual like Jack Torrance is struggling with a psychotic disorder like Jack Torrance, they may have the delusional belief that they coexist in two places at the same time. That psychotic process is called reduplicative paramnesia. And that's what The Shining is really about. And that's what that final portrait is really about. So if you focus on Jack Torrance's character, I think for the most part, we land on a psychotic disorder. And that psychotic disorder is probably schizophrenia. But reduplicative paramnesia is a syndrome often seen within schizophrenia. And it's the delusional belief. So it's a form of delusion. It's the delusional belief that the individual exists or a place exists simultaneously in two places and even times simultaneously. Right? And that all begins with the disclosure of Charles Grady at the very beginning of this movie. The observation and the scene that includes Delbert Grady and then is finalized in that portrait, which is literally the last thing we see. Right. We don't have enough time to talk about Bearman, and we don't have enough time to talk about that elevator scene and what is in that blood. Often, I think on Reddit, on YouTube, it's referred to as the river of blood. Mm-hmm. Again, when you have some time to do that, you're just mesmerized.
I'm on ChatGPT now. I'm fully in this.
We're going to end it here. I'll post next week's discussion on Twitter probably later on today. Thank you, everybody.